Simply Medicine. We're going to talk about a topic that's a little bit uncomfortable for you ladies out there, but it's important. We're going to talk about incontinence. We have a really great urologist who specializes in women's urology issues, so we're going to have a really good discussion about that. I'm Angenette Levy, and this is Simply Medicine on 55 KRC Detox Station. I'm Angenette Levy, and this is Simply Medicine on 55 KRC, the talk station. We've talked a lot about men's urinary health issues on this show, and I thought maybe we should turn to women's health topics on related to urinary tract issues and urology in general. And joining me to talk a little bit about that is Dr. Rebecca Roedersheimer. She is a urologist specializing in women's health issues at the Urology Group here in the Cincinnati area. Dr. Roedersheimer, welcome to Simply Medicine.
Thank you. Thanks for having me.
Let's talk about two issues. Let's start with pelvic floor weakness. I was reading a little bit about that. What is pelvic floor weakness?
So pelvic floor weakness is very, very common in women. Another term would be considered pelvic floor prolapse. Pelvic floor weakness is a loss of muscle tone in your pelvic floor muscles. So those are the muscles that surround your genital organs, including your bladder, your vagina, and your rectum. And it causes a lot of different symptoms in women, including urinary incontinence, urinary frequency and urgency, sometimes a symptom of pelvic fullness. It can sometimes lead to bowel issues as well, constipation, or even fecal incontinence, which is the loss of control of your bowels.
Oh, yikes. What causes pelvic floor weakness?
In general, pelvic floor weakness has to do with childbearing. So pregnancy and childbirth cause the pelvic floor muscles to get overstretched. It can affect the nerves in the pelvic floor. That leads to the weakness, which can cause the symptoms.
I hear about Kegel exercises, or you hear about the Kegel exercises, where you're supposed to kind of, this is a medical show, so we can talk about this a little bit. You're supposed to kind of act like you're holding in urine or something to kind of strengthen the muscles in that area. Does that do anything to help with pelvic weakness or not?
Absolutely. That's one of the first line therapies that I recommend for all of my patients. Even patients who don't have symptoms yet of pelvic floor muscle weakness, like after pregnancy, it's a really great idea. Even during pregnancy, it's a great idea to start doing Kegel exercises. The way I explain Kegel exercises to my patients is I say, think about if you're sitting on the toilet and going to the bathroom and someone walks in and you want to stop real quick. You're going to squeeze those muscles to kind of stop the urine. That's your pelvic floor. Those are the muscles you want to squeeze. Another way to think about it is if you're in a crowded room and you feel like you're going to pass gas and you want to hold it in, you're going to squeeze those muscles. Those are the muscles that you want to work and strengthen to help prevent and treat pelvic floor muscle weakness. I don't recommend that you do that while you're using the bathroom. What I recommend to my patients is that you do that while you're sitting at a red light. It's a good time to think about it. So if you're driving around and you're sitting at a red light, you might want to think about contracting your pelvic floor muscles. Hold it for 10 seconds and then relax. Hold it for 10 seconds and then relax. And if you do that every time you hit a red light, it's a good way to keep your pelvic floor muscles strong and healthy.
And are there other causes of, say, pelvic floor weakness other than childbearing? Does the kind of wear out over time as you age?
In general, childbearing is the most common. Now, that being said, many women and men who have not had children struggle with incontinence. Incontinence is a little bit separate than pelvic floor muscle weakness. And incontinence, it affects up to 50% of women and up to probably 15% of men. And that's just the involuntary loss of urine. So that has multiple causes, not just childbearing, obviously.
We're here talking with Dr. Rebecca Roedersheimer. She is a urologist specializing in women's urology issues at the Urology Group here in the Cincinnati area. Dr. Roedersheimer, one of the things as I get older and things like that, I think about that, and that you see the commercials for Depends and things like that. And that seems like something as you age, like that's one thing I look at and I would not want to have to deal with that. I don't want to wear diapers. I want to be able to keep control of that type of thing. How common is it as women age to become incontinent and maybe not be able to hold it? You have to go to the bathroom and you have no way of holding it until you get to the bathroom. Is that what happens?
Right. So it's very, very common, and it can affect up to 50% of women complain of involuntary loss of urine. And there are multiple different causes. There are also things that you can do as you age to kind of help reduce the risk of that happening. One is Kegel exercises, like we talked about. Another is just in general, keeping yourself healthy, keeping your weight under control. A good healthy weight will reduce your risk of being incontinent later in life. Daily exercise, a healthy diet. Certain things in your diet can certainly increase your risk of incontinence. A lot of caffeine, a lot of alcohol, sometimes spicy foods can really irritate your bladder and increase your risk of bladder leakage. So those are things I would try to avoid, especially if you're already struggling with incontinence. Those can kind of irritate your bladder and increase your risk.
Okay, the caffeine part, I don't have a problem with the alcohol part. I don't drink, but the caffeine part, a lot of us women live on coffee all day long. So
I'm
maybe
with you.
switch
I'm
to water.
sipping my coffee too.
All right. Well, this has been a really interesting conversation. Once you become incontinent, is there anything, the Kegel exercises obviously help, but is there anything else that can be done for that? Or is that just something you have to live with?
Absolutely not something you have to live with. I think incontinence it's a very upsetting problem. It's a physical toll, it's an emotional toll, it's a financial toll, like you said, talking about wearing pads and Depends and all that. So it's something that people should definitely reach out to their doctor to talk about. There are a lot of different treatment options, starting from as simple as physical therapy. We have some great physical therapists who can help patients kind of learn to isolate their pelvic floor muscles and strengthen them. Some diet and behavioral changes, like we just talked about, are helpful. We have medications that are helpful, and also some pretty minor surgeries that can treat this problem.
All right. Well, Dr. Rebecca Roedersheimer, thanks so much for joining us on this edition of Simply Medicine. Good information from you, and we look forward to talking with you in the future.
Thanks so much.